Next, I'm going to invite is Dr. Atul S. Putalat. Yeah. He will be speaking on FLUTO, that is filter light units for teleophthalmology, the future of smartphone filter light photography. Yeah, Atul.
Good afternoon, respected judges and my dear audience. I'll be talking about FLUTO, filter light units for teleophthalmology. As we know, fluorescein stain is put on cornea, and we usually take using a photo slit lamp and switching on the cobalt blue light filter, we are able to take the cobalt blue light images of the patient with the cobalt blue light that is emitted. This is provided that you have a photo slit lamp. But what if you don't have a photo slit lamp? In cases like in emergency ocular trauma, where you don't have an access to a slit lamp or even a photo slit lamp, or in ICU and chronic bedridden patients, in infants for photo documentation, or in ICAMs where you don't have slit lamp at all. So what can you do? So I thought to myself, what if I could develop an attachment for a smartphone that is low cost? What if this attachment can be used by anyone, any health assistant, doctors and MLOPs alike? Any health assistant should be able to use it. What if it's portable, pocket sized and easy in handling? What if it provides good quality stain positive or negative images and is reproducible? With these points in mind, we opened up the old slit lamp in the instruments department and we studied the cobalt blue filter that's in the slit lamp in detail. So we've understood there are two ways to achieve this. One is using the inbuilt smartphone flash, or we can use an external light source. The aim is to emit blue light. So I can either convert the flashlight into a blue light or provide a new blue light as such. So with this working principle in mind, by keeping a blue filter in front of the flashlight, which will emit blue light, which will fluorescence, and you can see it as green lesion in the patient's eye. We developed our first model. This we had called as the cobalt blue light unit, or C-blue. So these are the parts of the C-blue. And this was the first version developed around 1.5 years back. We photographed these images with the C-blue adapter, but then that was a bit cumbersome. It was a large unit. It did not fit all units. So we tried a few variants. We tried a C-blue clip. We tried a line light. We even tried a circular illumination setup. So but it was not universal. We wanted a universal design. So we went on to make a small, universal, cost-effective solution to this. So we developed this small patch that you see on the tip of my fingertips. It's called the blue patch, which was a truly universal design. So what is blue patch? It uses the same C-blue principle we discussed a while ago. It uses gum paper, so it is sticky. It's similar to a bindi strip that you can buy. So it comes as a strip. It's machine cut into precise circles. And it's a short video on how the blue patch is used. So you stain the patient's eye with sodium fluorescein strip, and you can use any smartphone. You don't need a high-end phone as long as it can capture. This is a 7-year-old model of Android phone. You can take a blue patch from the strip, stick it onto the flashlight of that phone, and just ensure that it is stuck properly and covering the flashlight. And then it is ready for your blue light photography. Now, after proper positioning, and you should use a dimly lit room or a dark room, which is preferred. And after correct focus, as you can see in the inset video image, the image of the patient can be captured. So we went on to a pilot testing of 34 patients with stain positive corneas. We collected user feedback, and also we gave the images captured to 2 expert graders to grade according to the criteria shown. So in the results, the user gave feedback that around out of 30 patients, people said it's very easy to use, and few others, as you see in the pie chart. In the expert grader analysis, where 1 and 2 is the best, 5 is the worst, most of them said 1 and 2. So they had good agreement with there was less artifacts, less blotchy appearance, diagnostic confidence was excellent, contrast was good, sharpness was good, and noise was less. Sorry. So after we developed the blue patch, we have now also developed glue, which is called the green light unit. We have just developed it this year, 2023, and we have already started testing it on patients to capture NVIs in the eye, or even using a 20D to capture RNFL defects if it's possible. The opportunities are many. So we use a red-free filter, which is attached onto the smartphone, as you see. And so this is a simple, inexpensive, very quick learning curve, and along with teleophthalmology, this promises development and quick relay through the internet, and it's also very accessible to all the people because it is a very handy thing, can be put in your pocket. And our vision is healthcare staff with minimal specialized training can remotely capture and transmit usable images to supplement and promote healthcare communication and efficiency. Thank you.
I think it's a very useful device.
This was, I think, in IGO last year, 2022.
Yes, ma'am. The first adapter I showed, I have published, ma'am. Yes, ma'am. So it's made of a gum sticky paper, sir, and we have tested it using spectrometers so that the correct wavelength that's needed is, and we are planning to go with make it commercial later on. Orolab is helping me with making the prototype final.
Yeah.
No, if it works well and if it is the price is very reasonable,
Yes.
it will be a wonderful tool for teleophthalmology.
Yes, sir. We're planning at 50 to 100 rupee per strip, which will at least give you four blue patches.
Okay.
That's the aim for teleophthalmology.
So anything else?
Thank you.
Thank you.